Before starting your chemotherapy treatment, there are some important details we'd like to share with you. As you watch the video, please have a pen and paper nearby to write down any questions that you would like to ask our healthcare team. Since your diagnosis and as you commence your treatment, you may experience a range of emotions and find things overwhelming. The process of diagnosis and commencing treatment is full of many unknowns and can be very daunting. These are all normal reactions to a difficult situation, but there are ways to manage these feelings so they do not overwhelm you. We want you to know that we're here to support you. We offer guidance, reassurance, support, and information to help prepare you for your upcoming treatments. Complementary to your personal support network, there are a number of other support services accessible to you, both at MARTA and outside of the hospital. Our nurses and doctors will continually reassess your condition and offer support as needed. We also encourage you to voice any concerns you may have, from coping with your diagnosis to side effects from treatment. We want to empower you through your healthcare journey with us. Many of us find it difficult to ask for and accept support, even when we need it the most. When facing a diagnosis of cancer and the demands of treatment, having a strong support network can make an enormous difference. Your nursing team may suggest additional supports to assist you during this time. This may include a referral to a social worker who can assist with accessing services like Centrelink, insurance, and superannuation. What is cancer? Your body is made up of trillions of cells. Your healthy cells normally grow and multiply in a controlled way. Once they have performed their designated function, they follow the normal process of cell death. The term cancer describes the many diseases that occur when the body's cells do not replicate in this controlled way. Every day we replicate our cells with new cells. Sometimes there can be a mistake in this process. The immune system ordinarily detects the error and gets rid of these cells before they have a chance to replicate themselves. If for some reason the immune system misses the error, there can be an uncontrolled multiplying of cells. This can cause a tumour forming or abnormal blood cells. When these cells spread into surrounding areas and travel to different parts of the body, they can cause disruption to the normal functioning of healthy cells, tissues, and organs. A malignant tumour is one that can spread via the lymph system or blood vessels. A benign tumour is one that cannot spread. When a malignant tumour uses the lymph nodes or blood vessels to spread to another part of the body, we call it metastatic disease. There are many different kinds of cancers, which is why there are different kinds of treatment options available, including chemotherapy, immunotherapy, targeted therapy, surgery, and radiation. These treatment options can be used on their own or in a combination. The type of treatment will depend on the type of cancer you have, where it has started in your body, the stage of the cancer, as well as your age and general health. All of these options will be discussed with you and your doctor to find the most effective treatment for you personally. Because treatments are personalised specifically to you and your diagnosis, not everyone is eligible for each treatment. Chemotherapy is still widely used for most types of cancer. In some cases, chemotherapy can also be used with radiation or immune therapies too. To determine the best treatment for you, we'll take a biopsy of the tumour when you're diagnosed. Once the biopsy results are known, your doctor will then prescribe a treatment which we know is proven to be effective for your specific diagnosis. Chemotherapy is a medication used to kill or slow the growth of the cancer cells. As there are a number of different cancer types, there is also a large variety of different chemotherapy medications to treat these. More than one chemotherapy medication can be used to ensure effective treatment of the cancer, as each chemotherapy works differently in the body. The type of chemotherapy is dependent on what is most effective for your tumour and your general well-being. Chemotherapy attacks rapidly dividing cells as well as the cancer cells, which is why people have side effects from treatment. The doses you will be given will depend on your height and weight for most treatments. The nursing team will continue to weigh you prior to each chemotherapy session. There are also immunotherapy treatments emerging, where they support the immune system to attack the cancer cells. Both treatments have side effects, however, not all cancers currently have an immunotherapy option available. There is a lot of research being done into immunotherapy and, if available and appropriate, these options will be discussed with you by your doctor. Immune and targeted therapies work on specific cells or molecules. Two people may have the same general type of cancer, but on further testing, only one person may be eligible for the immune therapy. Chemotherapy can affect normal cells that grow and divide rapidly, like those in the bone marrow, the digestive tract, skin, hair, and reproductive organs. Side effects can vary greatly. For some people, they may experience very few side effects, while others will experience a whole range. Most side effects are temporary and can be managed. Throughout this journey, it is important to speak to your doctor and nurses about your side effects so we can treat these sooner and stay on top of them. Your treatment can be given in several different ways, including intravenously or through a drip, injections, creams, or orally with tablets or capsules. Intravenous or IV therapy is administered directly into the bloodstream. It can take anywhere from 10 minutes to several hours to be infused. Often, you will be given medications prior to your treatment to assist with the management of side effects like nausea. There are multiple ways to receive IV treatment. The best method for you will depend on the type of treatment, how often it will be administered, how long the treatment will last, and your veins. For some people, having blood tests or an IV drip inserted is difficult. The first method is a cannula, typically inserted into the forearm. This is a temporary cannula that is inserted on the day of treatment and then removed before you go home, unless you're admitted to the hospital, in which case it can be left in for longer. The second option is a peripherally inserted central catheter, also known as a PICC line. This device can be left in for months. A PICC line is inserted in radiology with a local anaesthetic. This stays in the inner arm, above the elbow, until it is no longer required, and is always covered by a clear dressing. The PICC line does require a weekly dressing by an oncology nurse. The dressing will need to remain clean and dry, so will need to be covered for bathing and showering. This means you cannot go swimming while the PICC line is in. The removal of a PICC line is a relatively painless procedure and can be done at the end of treatment by your nurse. The third option is a portacath. This is a longer-term access device that can be left in for up to 10 years. This device is an implant, so you can swim and bathe normally. The implant is put in under sedation as a day procedure. When required, it is accessed with a specialised needle by the nursing staff. The needle is then removed once treatment is completed. When not in use, the port will need to be accessed and flushed at least every 6 to 8 weeks. The port is also removed under sedation in the day procedure unit when you no longer require the port. You can have your regular blood tests from both the PICC line and the port instead of from your arm by a cancer care nurse. Community pathology centres cannot access these devices. The PICC line and port can be great options for those who have difficulty with cannulation or have treatment over a long period of time. Please ask your nurse or doctors about the risks and benefits of these different devices. Before each treatment, you will need to get a blood test. This can either be done on the day of or 1 to 2 days prior to treatment. If you are receiving treatment at Mater Cancer Care Centre, our reception team will give you a self-assessment form. Please complete this form and give it to your healthcare provider before treatment. By completing this form, it will help us in detecting and monitoring any side effects and distress levels. This will assist us in treating and managing these concerns before they become serious. The form includes a distress thermometer, which we can then use to make referrals to the cancer care coordinators and allied healthcare team if required. Throughout treatment, you may find that you have side effects or personal circumstances that change, and this may cause some distress for you. It is important to rate your distress levels honestly. This can be a very difficult time in life, and we want to ensure you have the support you require. The nurses will also do a physical assessment, including taking your blood pressure before your treatments and throughout your stay with us. Whenever your healthcare team commence, administer, change or remove your treatment, they will be wearing protective equipment. This will include a long-sleeved gown, a face mask, purple gloves and goggles. They will also wear this outfit when handling any of your bodily fluids. The purpose of this equipment is to protect the nurses from continual exposure to the treatment. Your visitors are more than safe to remain in the room while you receive your treatment. We recommend that young children do not come into the cancer care centre due to the infection risks to other patients and personal safety for the child. Fatigue is a very common side effect of all cancer treatments. Fatigue can be due to the cancer itself, the treatment, any infections, anxiety, or just the extra demands on your body to get to appointments. Energy conservation is really important during treatment. It is often hard for all of us to ask for help, but now is the time to delegate to your family and loved ones, or even community services. Try to save your energy and only do the things that need to be done. Exercise can be beneficial both physically and psychologically, and can in fact improve your energy levels. The exercise should be light, like a leisurely walk. If you normally do high-intensity exercise, we encourage you to discuss your exercise regime with your doctor first, as you may need to alter your exercise routine. Short naps can be helpful, but be sure not to nap any longer than an hour at a time, or too close to your bedtime. You need to make sure you're still getting quality sleep overnight to allow for a better recovery. If you are planning to continue working while receiving treatment, we encourage you to think about reducing your hours, accessing sick leave, or utilising income protection. If you'd like assistance with these concerns, please approach your nurse, who will refer you to a social worker. It is common for your appetite to change during chemotherapy. You may experience changes to your taste or not feel hungry. You may not enjoy the foods you usually eat or crave foods that you do not normally eat. You may also experience nausea or vomiting as a side effect. If your treatment has the potential to cause nausea, you'll be given some anti-nausea medications prior to treatment. We'll also give you anti-nausea medications in tablet form to take after treatment at home if needed. If you still feel nauseous, please let us know. You should not feel so nauseous that you cannot keep any food down. If you are unable to eat or drink, please go to your local emergency department for treatment of your nausea and vomiting. Eating smaller, frequent meals instead of 3 large meals a day may be more manageable for you with a changed appetite. Having smaller, frequent meals or snacks can reduce the feeling of nausea and ensure that you still have enough nutritional intake. Mild flavours and cold foods are often better tolerated if you're feeling nauseous. Please continue to take your anti-nausea medications as prescribed. If you are losing weight or having difficulty with nausea, a referral to a dietitian can be made to assist with dietary options and supplements. Not everyone loses their hair, but it will depend on what chemotherapy treatment you receive. Your doctor and nurses will let you know if your treatment will cause hair loss. Hair can be lost from the scalp, eyebrows, eyelashes, armpits, pubic area, face, chest, arms, and legs. Essentially, anywhere hair grows on your body. Hair loss usually occurs 2 to 3 weeks after your first treatment. In most cases, your hair will grow back. It is natural to find hair loss difficult, so please speak with your healthcare team about this. Wigs, turbans, and scarves are a nice option to consider and can be purchased from specialist companies. Look Good, Feel Better is a support group that can help with skincare, makeup application, and learning how to style wigs, turbans, and scarves. They also run sessions for men to discuss and demonstrate skincare, shaving, and body image. You can register online or over the phone and attend a session at Mater Cancer Care Centre in South Brisbane at no cost. The lining of the mouth can become inflamed and sore during chemotherapy and cause general irritation or mouth ulcers. Please let us know if you notice any changes in your mouth or throat, like dry mouth, discoloration of the tongue, sores, ulcers, or if you are finding it difficult to swallow. The use of mouthwashes can help to ensure all food particles have been removed after eating, reducing the risk of ulcers. You can use a half teaspoon of bicarb soda or salt in a glass of water. You can also use Biotine, a non-alcohol based mouthwash that has a minty taste. Please avoid regular mouthwashes as these can often further irritate the inside of your mouth. Please use a soft toothbrush to reduce the risk of irritating the gums. Avoid acidic or spicy foods. If you require any dental care during treatment, please discuss this with your doctor prior to visiting the dentist, as this may impact your cancer treatment. Peripheral neuropathy often starts as a tingling or pins and needles sensation in your hands or feet. It can also progress to numbness or pain and discomfort or loss of motor function. It is important to report any signs of neuropathy to your healthcare team. Not all chemotherapy treatments cause peripheral neuropathy. There can be some improvement of these symptoms over time, especially after a treatment has finished. Some ways to manage neuropathy at home include wearing gloves or using tea towels when handling cold or hot food in the kitchen to prevent pain when handling these items. Wearing enclosed footwear, even around the house, to protect you from injuring your feet or not noticing pain and sores. Drinking room temperature water. Taking care when bathing or washing dishes. You may not be able to feel the water temperature accurately and may accidentally get a hot water burn. Chemotherapy may disrupt the manufacture of your blood cells after receiving treatment. This may result in some changes to your blood test results, often referred to as your counts. Inside your bones is marrow, a soft, spongy material where your blood cells are manufactured. Because this is a rapidly dividing cell, it can be impacted by chemotherapy. Before each treatment, you will need to get a blood test. This can either be done on the day of or 1 to 2 days prior to treatment. This test will also check your electrolytes, kidney, liver function, and any additional tests your doctor has requested. Your red blood cells are responsible for delivering oxygen to the body and carrying iron. If your red blood cell count drops, it is called anemia. The signs and symptoms of anemia include feeling tired, dizzy, short of breath, and having difficulty concentrating. If your red blood cells drop too low, you may require a blood transfusion, but not all patients require this. Platelets are cells that help clot the blood and prevent bruising. A decrease in platelets can cause you to bleed for longer than normal or bruise more easily. Be careful when using sharp objects in the kitchen and use a soft toothbrush to avoid irritating your gums when you're brushing your teeth. Please present to emergency if you notice any blood in your urine or stools and if you have any uncontrolled nosebleeds. Your white blood cells are your infection-fighting cells. There are many different types of white cells, including neutrophils, that are our first defense against infection. Chemotherapy can cause the white blood cell numbers to drop, which can make you more susceptible or prone to infection. Getting an infection while having chemotherapy can be very serious and should be treated as an emergency. Keep an eye out for a temperature of 38 degrees Celsius or above, chills or sweats, persistent or severe vomiting, unusual bleeding, a sudden increase in pain, redness or swelling around an IV device. If you have a temperature, please go to your local emergency department for assessment and treatment. If you are very unwell, or if you don't have a loved one to bring you to hospital, call 000 immediately for an ambulance. Do not drive yourself to hospital if you're significantly unwell. Please bring your medical alert card with you. Be sure to keep this in your wallet at all times. The card will inform the emergency department staff of what treatment you're receiving, so they can make sure to provide the best care for you. If you would like any advice regarding your treatment or management of side effects, please call your local Mater Cancer Care Centre. If you're calling after hours, please call the main hospital switchboard and they'll be able to connect you to the on-call team. If your private doctor has provided you with an after-hours contact, please call that number for advice. To keep your treatment plan on track, it's important to stay as healthy as possible. The common cold or flu can be hard to avoid, but following these simple tips will help you to avoid infection during treatment. This is another reminder to check your temperature at least daily during treatment. You can use an oral thermometer, which can be purchased from any pharmacy. If you are feeling hotter than normal, shivering, or not feeling 100%, recheck your temperature. If you notice that your temperature is gradually going up, or if your temperature is above 38 degrees Celsius, go to your local emergency department as soon as possible to treat a potential infection or reaction. Please note, taking paracetamol may mask a potential temperature, so please check your temperature before taking any painkillers. Be mindful of food preparation during treatment. For example, eating well-cooked foods, safely storing foods by freezing leftovers and eating fresh foods when possible are all great steps towards maintaining a healthy and safe diet. Visitors are important and encouraged. However, if they are unwell, please ask them to stay at home and visit you when they're well again. Avoid heavily crowded areas when undergoing treatment, like the supermarket during busy periods, school pickups, or large events. Wash your hands regularly, especially before and after handling food and using the bathroom. Encourage family and friends to do the same. Treatment can cause irritation to your gut. Chemotherapy, pain relief, and anti-nausea medications may cause either constipation or diarrhea. If you experience constipation, there are some laxative foods like pears and prunes that can naturally assist with bowel movement. Drinking lots of water and having high fibre foods is also important. Maintaining gentle activity can also assist the bowels to move. There are medications available over the counter if changing your diet doesn't work, like Caloxyl with Senna and Movicol. Please ask your healthcare team for advice prior to taking these medications. If you experience diarrhea, try avoiding spicy foods, dairy products, fatty or fried foods. Limit or have no alcohol and drink plenty of water to stay hydrated. You may need medication like GastroStop to stop the diarrhea. Please speak with your healthcare team before taking these medications to ensure the diarrhea has been caused by the treatment and nothing else. Your cancer treatment may cause some changes to your skin, including rashes or new sensitivities, especially if you are having radiation treatment. While you can't prevent a skin reaction caused by the treatment, you can maintain healthy, moisturized skin to lessen the impact of these side effects. Using unperfumed and neutral products can help. Moisturize your skin daily and after a shower or bath. As your skin may be more sensitive, using a pH-neutral, non-perfumed product is recommended. Heavily perfumed products are more likely to cause irritation. Some products to look for at your local pharmacy are Dermaveen, Cetaphil, or Mugu. Protecting your skin from the sun by using sunscreen and wearing protective clothing is highly recommended. Please report any changes to your skin to your healthcare team. Check your skin in the bathroom mirror at home regularly to be on the lookout for any changes. Chemotherapy can be found in your bodily fluids and blood for approximately 7 days after your last treatment. During this 7-day period, it is important to implement some extra precautions to avoid chemotherapy exposure to your family and loved ones. When using a toilet, please ensure that you close the lid and use a full flush. This is to prevent any aerosols from your urine. If your clothing or bed linen is soiled, wash them separately in a full cycle of hot water and hang your washing out to dry in the sun. But if your clothes and linen aren't soiled, they can be washed with anyone else's clothes on a cold wash. If there are any spills of bodily fluids like vomit or urine, clean it up with warm soapy water. If someone else is cleaning up, please make sure they use gloves or avoid direct contact with the bodily fluid. Normal contact with other people is okay and encouraged. Please wash your hands after taking any chemotherapy tablets and after going to the bathroom. Your chemotherapy may impact on your desire or ability to have sex. This may be because you feel tired, unwell, less confident, or there may be a physical concern preventing you from being able to have sex. Chemotherapy can be found in trace amounts in both semen and vaginal fluids. We encourage you to discuss your concerns around sex with your healthcare team. Sex may not always be possible, but closeness and sharing can still be a part of your relationships. For women, it is recommended that during your treatment and for the initial months after, that you do not fall pregnant. For men, it is recommended that they do not father any children. Your treatments could cause harm to an unborn child. If you do fall pregnant or father a child during this time, please discuss this with your doctor immediately. Please discuss pregnancy avoidance methods with your healthcare team. If you are wanting to have children in the future, please talk to your doctor about your fertility and future options too. Above all, keep the lines of communication open, as there may be ways that we can help you. We often get asked to answer some common questions or bust myths surrounding chemotherapy. Can you catch cancer? No. Is cancer always terminal? No. Many cancers are very treatable. Will I be vomiting all the time? No, this is not normal. But if you are experiencing nausea and vomiting at home, please contact your healthcare team for advice and treatment. Will I lose my hair? Some chemotherapies do cause hair loss, but not all. Please check this with your nurse or doctor. Can I be around pregnant ladies, newborns or children? Yes, as long as they are healthy and well. This is to avoid you picking up any coughs or colds. You have been given a lot of information in this session, but the main take-home messages we want you to remember are that we are here to support you. Don't be afraid to ask for and accept help from friends and family. Don't hesitate to ask us questions about your treatment or side effects. Check your temperature regularly. Go to the emergency department if your temperature is above 38 degrees Celsius or you are unwell and concerned. Please ensure you know who to contact if you have any questions or concerns. If you have any other questions, please speak to a member of your healthcare team for clarification.